Anatomical positions. Supine position. It is a back-lying position with arms on the side. Uses. Physical examination. Resting. Undergoing anesthesia. Lung biopsy. Abdominal and breast surgeries. Dorsal recumbent. It is also a back-lying position. In this patient's head and shoulder may elevated on a small pillow. Arms are resting on side. Legs are apart with knees flexed and foot resting on the bed. Uses. Physical examination of abdominal and genital area. Perineal care. PV examination. Trendelenburg. Patient is lying on the back with arms on the side. In this position, bed is positioned in such a way that head of the bed is lower than foot of the patient and there is no flexion at the waist level. Uses. Shock patient. Hypotensive patient. Pelvic surgeries. Cord prolapse patient. Air embolism. To shift abdominal organs upward during certain surgeries. Reverse Trendelenburg. It is just opposite to Trendelenburg position. In this position, head of the bed is elevated than the foot level with no flexion at waist level. Uses. To minimize gastroesophageal reflex. Laparoscopic cholecystectomy. Lateral position. Patient is lying either on left or right side, with hip and knees flexed, top leg in front of the bottom leg. In this position, pressure on the back and coccyx will be relieved and pressure is distributed along the scapula, lateral aspect of the ilium and the greater trochanter of the femur. Uses. To promote lung and cardiac function. To relieve pressure on back and coccyx. After liver biopsy, right lateral position. During seizure attack and air embolism, left lateral. Patient with pyloric stenosis after meal, right lateral to promote entry of food into stomach and intestine. Sims position. Patient is lying on left side with semi-prone position. One arm is located behind the patient and other arm is flexed at shoulder and elbow. Both legs are flexed at the level of hip and knee, but the upper leg is more flexed and is drawn up to the level of chest. Uses. Rectal examination. Administering enema. To prevent aspiration. Low Fowler's position. In this, head of the bed is elevated at 30 degrees with flexion at the level of waist. Uses. To prevent aspiration during tube feeding. During increased ICP. Semi-Fowler's position. In this position, head of the bed is elevated to 45 degrees with flexion at the level of waist. Uses. To promote lung expansion. Paracentesis. Tracheoesophageal fistula. To relieve tension on surgical site following abdominal surgeries. High Fowler's position. Head of the bed is elevated at 90 degrees with flexion at the level of waist. Uses. Asthma. COPD. Emphysema. Pleural effusion. ARDS. To prevent the risk of choking. To relieve respiratory distress. Nasogastric tube intubation. Orthopneic position. In this position, patient is sitting on or side of a bed, with an overhead table to lean forward. Pillows will be provided to increase the comfort level of the client. Uses. Pericarditis patient. Thoracentesis. ARDS. COPD. Asthma. Emphysema. To relieve respiratory distress. Prone position. Patient lying on the abdomen with head turned on one side. To promote comfort, pillow can be used under head and a small pillow or towel roll can be used under the abdomen. Uses. To prevent aspiration. Recovery position after anesthesia. To relieve pressure on back and coccyx. Renal biopsy. Neural tube defect. Position after spinal surgery and hemorrhoidectomy. Lithotomy position. Lying on back with legs flexed at hip and knee joint and legs are supported with leg rest and strap. Uses. Childbirth. Pelvic gynecological surgeries. Transurethral resection of prostate, TURP. Knee chest position. Genopectoral position. Patient rest on the knees and chest with head is turned to one side, arms extended on the bed, and elbows flexed and resting so that they partially bear the patient's weight. The abdomen remains unsupported, though a small pillow may be placed under the chest. In this position severe hypotension occurs because of pooling of blood in the extremities. Uses: sigmoidoscopy, lumbar laminectomy,